Hello, my name is Adam Briggs, and I'm an assistant professor of psychology at Eastern Michigan University. And today, I'll be presenting on a project I completed as part of my dissertation while at the University of Kansas under the mentorship of Dr. Claudia Dozier, titled Further Investigation of Differential Reinforcement of Alternative Behavior Without Extinction for Escape-Maintained Problem Behavior. Recent prevalence studies suggest that approximately 40% of individuals with intellectual and developmental disabilities engage in problem behavior, and upwards of 25% of those individuals engage in severe problem behavior, such as self injury and aggression. As evidenced by hundreds of studies, functional analysis, or FA methodology, is the prominent assessment for determining the function of problem behavior. And researchers have shown that methodological and procedural extensions of functional analyses have resulted in an improved and refined methodology. One extension or refinement of methodology involves the development of more efficient and potentially safer functional analyses for determining the function of severe problem behavior. In addition to conducting risk assessments and implementing procedural safeguards, researchers have modified functional analyses to increase their efficiency and potential safety by conducting functional analyses of shorter sessions or total duration, conducting functional analyses of behaviors that reliably precede the occurrence of severe problem behavior, and using latency measures rather than repeated measures in functional analyses. In a recent series of studies, Thomas and Sassy and colleagues replicated previous research showing that response latency is a valid measure of response strength, and extended previous research showing that latency measures may be useful in functional analyses when repeated occurrences of problem behavior are undesirable or impractical. Furthermore, their data showed that fewer instances of problem behavior were observed in latency-based functional analyses. So if this is the case, this assessment might be ideal for determining functions of severe problem behavior. In addition, epidemiological studies suggest that approximately 35% of problem behavior is maintained by social negative reinforcement, and differential reinforcement of alternative behavior, or DRA, is a common treatment for problem behavior maintained by this function. This intervention often involves the delivery of the functional reinforcer for an appropriate alternative response and extinction for problem behavior. In fact, numerous studies have shown that extinction or other consequences for problem behavior are an important and sometimes necessary component of DRA. However, there are potential challenges associated with extinction that make it difficult or sometimes impossible to implement, particularly for instances of severe problem behavior. In addition, it may be physically impossible or unsafe to continue implementing escape extinction with some individuals. Given these challenges, researchers have begun to focus on manipulations to increase the efficacy of DRA without extinction. Specifically, researchers have conceptualized DRA as a concurrent operance arrangement and have manipulated dimensions of reinforcement to influence responding toward an appropriate response alternative as compared to problem behavior. In fact, researchers have shown that manipulating the magnitude, quality in which preferred stimuli are delivered for MANS or compliance, and some combined dimensions of reinforcement have been effective when treating problem behavior maintained by social negative reinforcement. However, given that either few or no studies have evaluated the effects of dimensions of reinforcement other than quality, evaluated the effects of combined dimensions of reinforcement, included within subject evaluations of single and combined dimensions of reinforcement, or evaluated whether the reinforcement schedule could be thinned to manageable levels. This area of research is limited and replications and extensions are needed. Therefore, the purpose of our study was to replicate previous research on latency-based functional analyses to determine the function of problem behavior, evaluate the single and combined influence of magnitude and quality of reinforcement within the context of DRA without extinction for problem behavior maintained by social negative reinforcement, and determine whether reinforcement schedules could be thinned with the use of tokens. So first, I will describe the methods of our study one, in which we use latency-based functional analyses to identify functions of severe problem behavior. 4 individuals referred for the assessment and treatment of severe problem behavior participated in this evaluation. Prior to the functional analysis, we determined procedural safeguards to be used in all functional analysis and treatment sessions to ensure the safety of the participant and therapist. Specifically, procedural safeguards for participants included immediate treatment of injury if it were to occur, session termination criteria if the problem behavior escalated in magnitude, and pre and post session examinations using the self-injury trauma scale. Procedural safeguards for therapists included the use of protective equipment, response blocking, and the availability of additional support staff if needed. During test sessions, the therapist delivered program consequences for the first occurrence of the target behavior. In the divided attention, escape, tangible, and social avoidance test conditions, the therapist terminated sessions immediately following the delivery of the program consequence, or when the 5-minute session duration had elapsed, whichever came first. During no interaction in play sessions, the therapist terminated the session either 1 minute after the occurrence of the target problem behavior or when 5 minutes had elapsed, whichever came first. And we used a multi-element design to demonstrate experimental control. So here are the results. In this and subsequent FA graphs, sessions are scaled along the x-axis and the latency in seconds to problem behavior along the y-axis. Data points graphed above 300 seconds depict sessions in which problem behavior did not occur. Anna's aggression occurred at shorter latencies in the escape condition as compared to the control condition, suggesting her problem behavior was maintained by escape from demands. Brock's aggression occurred at shorter latencies in all test conditions as compared to the control condition, suggesting that his problem behavior was maintained by all social reinforcers, escape, and access to attention, edibles, and leisure items. Although this pattern of responding may also suggest automatic reinforcement, given that his problem behavior was aggression, this was unlikely. Janice's self-injury and aggression were also maintained by escape only. In the second phase of the functional analysis, we conducted a pairwise evaluation to clarify whether problem behavior was maintained by access to leisure items, because occasionally we observed shorter latencies to problem behavior under this condition in the initial functional analysis. Results of this subsequent analysis ruled out this variable as a maintaining function. And finally, Queenie's aggression was also maintained by escape. Next, we evaluated various DRA without extinction interventions for problem behavior maintained by social negative reinforcement. Prior to the DRA without extinction evaluation, we conducted several assessments to determine preferred leisure items and edible items, as well as preferred types of attention for each participant. Additionally, we wanted to show that tokens we would later use did not function as reinforcers in the absence of backup reinforcers. In the DRA without extinction evaluation, sessions were 10 minutes in duration, and demands were presented using a 3-step prompting procedure. In all sessions, problem behavior resulted in a 30-second break. Rate of problem behavior and percentage of compliance were our dependent measures. And we used a reversal design to demonstrate experimental control. During our evaluation, participants progressed through a series of DRA without extinction conditions involving the manipulation of magnitude, quality, and a combination of both dimensions. As mentioned, during all conditions, problem behavior always resulted in 30 seconds of escape. However, what differed across conditions were the consequences for compliance. So during baseline, compliance resulted in brief praise only. During the equated consequences condition, compliance resulted in the same consequence as problem behavior, 30 seconds of escape. During the magnitude manipulation, compliance resulted in 2 minutes of escape. During the quality manipulation, compliance resulted in 30 seconds of escape with access to high preferred attention and leisure and edible items. During the combined magnitude and quality manipulation, compliance resulted in 2 minutes of escape with access to those same high preference stimuli. During the enhanced combined condition, compliance resulted in 4 minutes of escape with access to those same preferred stimuli. So once we demonstrated treatment effects, we determined whether these effects would maintain as the schedule of reinforcement for compliance was thinned. That is, once we found a particular condition to be effective, we introduced tokens and delivered them on an FR1 schedule for compliance. Token exchange rate was systematically increased from an FR1 to an FR2, and then increased by 2 until either a schedule was reached in which consistent maintained effects were observed, or the terminal goal of an FR20 exchange rate was reached. Throughout this schedule thinning phase, probes were conducted at the terminal exchange rate to determine whether tokens would maintain responding without further schedule thinning. These were conducted immediately following every third thinning step in which our thinning mastery criterion was met. Next, I'm going to review the results for 2 participants, each of whom were representative of 2 general patterns of responding we observed during our DRA without extinction evaluation. For this and all subsequent graphs, sessions are scaled along the x-axis. Rate of aggression is scaled along the y-axis in the top panel. And percentage of compliance is scaled along the y-axis in the bottom panel. For Anna, during the initial equated condition, she engaged in low levels of aggression and moderate levels of compliance when both resulted in a 30-second break. Next, we implemented baseline, in which aggression resulted in a break and compliance resulted in only praise, in an attempt to demonstrate experimental control. Anna engaged in high levels of aggression and moderate levels of compliance in this condition. However, in the reversal back to the equated condition, previous treatment effects were not replicated. These data suggest that 30-second breaks for compliance might initially maintain responding on a dense schedule. However, once aggression contacted reinforcement in baseline, this responding competed with compliance to access the 30-second break. Next, in the magnitude manipulation, in which compliance now resulted in a 2-minute break, Anna continued to engage in high rates of aggression and low levels of compliance, suggesting that simply increasing the duration of escape for compliance under a dense schedule was not effective, despite contacting that contingency and experiencing this extended break. Next, Anna progressed to the quality manipulation, in which compliance now resulted in a higher quality break, that is, a 30-second break with high preferred toys and attention. Anna's aggression decreased and compliance increased. Following a reversal to the equated condition, in which aggression returned to previously high levels, we introduced tokens on an FR1 schedule, and based on 2 consecutive sessions with problem behavior below a 90% reduction from our comparison condition, and indicated during thinning phases on the graph by the horizontal red line, schedule thinning entailed systematically increasing the token exchange requirement. However, treatment effects did not maintain in the subsequent quality condition. These results suggest that a high quality break that was the same duration as the break for problem behavior was not effective for maintaining these effects, even under a dense schedule of reinforcement. Next, Anna progressed to the combined dimension manipulation, in which compliance now resulted in a 2-minute break with preferred items and attention, and Anna's aggression decreased and compliance increased under this condition. Following a brief reversal to the equated condition, Anna returned to the combined condition, tokens were introduced on an FR1 exchange schedule, and with the exception of a few initial sessions, effects were replicated, as the exchange schedule was systematically thinned to an FR4. At this point, we conducted a terminal probe at the FR20 exchange schedule, as indicated by the closed data points, and stable treatment effects were eventually observed across the final 7 sessions. These data suggest that DRA without extinction was effective at decreasing Anna's rate of aggression and increasing compliance when both the magnitude and quality of reinforcement were manipulated to favor compliance, which maintained even as the schedule was rapidly thinned from an FR4 to an FR20. Similar results were obtained in that we were able to rapidly thin to the terminal schedule with one other participant, Queenie. So these are the data for Brock. During the initial equated condition and magnitude condition, Brock engaged in high levels of aggression and low levels of compliance. During the first quality condition, Brock's aggression decreased to near 0 rates and compliance increased to relatively high rates. Following a reversal to the equated condition, we initially replicated the quality effects under an FR1 schedule with tokens. However, treatment effects were lost each time we attempted to increase the response requirement, which we could not regain even after moving back to denser schedules of reinforcement. Next, Brock progressed to the combined dimensions condition, which resulted in immediate treatment effects. Following a brief reversal to the equated condition to demonstrate experimental control, treatment effects were replicated with tokens under an FR1 schedule. Next, we were able to successfully thin the exchange schedule to an FR4. Following this, we conducted a terminal probe and initially observed maintained treatment effects under an FR20 exchange schedule. However, these effects were lost after only a few sessions. Next, we successfully thinned the exchange schedule to an FR10 and conducted several more terminal schedule probes. Again, we initially observed treatment effects, but these effects did not maintain over time. Next, we attempted to continue with systematic thinning. However, we observed treatment effects break down once we reached about the FR16 schedule with Brock. Further, treatment effects were difficult to reestablish again, even after moving back to several denser schedules of reinforcement. Eventually, stable responding was achieved at the FR10 schedule, which maintained for the final 10 sessions. Similar to the other participants' results, Brock's data suggests that DRA without extinction was effective when both the magnitude and quality of reinforcement were combined. However, treatment effects did not maintain at the terminal schedule, and stable treatment effects required a relatively denser schedule of reinforcement. Similar results were obtained with our fourth participant, Janice, in that maintenance of treatment effects required a dense schedule of reinforcement. Overall, our DRA without extinction evaluation suggests that the equated condition resulted in initial effects for Anna and Janice. However, these effects were not replicated either following baseline conditions or they just failed to maintain over time. Interestingly, the magnitude condition was ineffective at producing treatment effects for all participants. The quality condition was initially effective for all four participants. However, these results were either not replicated following a history of other conditions or became ineffective during thinning under relatively low exchange schedules. The combined condition, in which both magnitude and quality of reinforcement were manipulated, was effective for 3 out of the 4 participants, and those effects maintained even when the schedule was thinned to a relatively lean schedule. Finally, the enhanced combined condition with a 4-minute break was required for maintained therapeutic effects for Janice, but most consistent results still required a dense FR1 schedule. So to summarize, the results from Study 1 and Study 2 suggest that functions of problem behavior can be effectively identified in a potentially safe and efficient manner, and that effective treatments can be developed in the absence of extinction by manipulating a combination of magnitude and quality of reinforcement for compliance. And these effects can be maintained at relatively lean schedules with the use of tokens, which may lead to better long-term maintenance and generalization of therapeutic effects. These results have important clinical implications because extinction might not always be an option, and the results of this study provide further evidence of the effectiveness of alternative strategies to alleviate these concerns. Further, because potent reinforcers were identified and delivered for compliance, this treatment approach might be more practical for caregivers to implement because their focus could be on increasing compliance, thus increasing overall learning opportunities. Finally, because procedures were developed for effectively thinning the schedule of reinforcement for compliance, while problem behavior continued to result in the functional reinforcer, this information should help to inform a manageable level of implementation for caregivers, thus leading to long-term maintenance and generalization. Now, although these studies produced interesting findings, there are some limitations, as well as areas for future research worth discussing. First, we did not collect data on problem behavior between functional analysis sessions, which limits our ability to make confident assertions regarding the potential safety and time efficiency of the latency-based functional analysis. Therefore, future researchers should collect and report on these measures to more accurately support these assertions. Second, given the purpose of the treatment evaluation was to determine the influence of various dimensions of reinforcement on the efficacy of DRA without extinction, the treatment did not allow for validation of FA outcomes. So future studies should be conducted to accomplish this. Third, the mechanism by which treatment effects are obtained is unclear. Two possible explanations for these findings have been discussed in the literature. First, these outcomes might be explained in terms of the principles of choice responding, in which the alternative response and problem behavior are these concurrent operants, and the participants' motivation for positive reinforcement is greater than their motivation for escape, resulting in more responding toward the compliance. Second, the provision of positive reinforcement during the instructional context may function as an abolishing operation that momentarily decreases the value of escape and in turn decreases problem behavior to access it. Now, it's possible that one or both mechanisms are operating across different individuals, and determining the mechanism for a particular individual may be helpful in determining the most effective intervention in the long term. Fourth, although results of the schedule thinning suggest that the use of tokens was effective for successful and rapid thinning under some conditions, it's actually unclear whether the tokens were necessary at all. Therefore, researchers should consider comparing schedule thinning under conditions in which tokens are and are not available. In addition, based on some of the breakdowns and treatment effects with schedule thinning, it's actually possible that the tokens became aversive because they signaled work periods or were associated with these rapid increases in response requirements. Finally, although dense schedules of reinforcement for the alternative response resulted in exclusive allocation towards compliance, once schedule thinning was introduced and compliance did not reliably result in reinforcement, we observed increases in problem behavior across all four participants. These results suggest that problem behavior is likely to remain a member of the functional response class so long as it's not exposed to prolonged periods of extinction. Therefore, other strategies such as the use of stimulus control procedures and programming for multiple appropriate response alternatives for mitigating resurgence during reinforcement schedule thinning without extinction will likely need to be explored. So if you're interested in reading this study in full, it's published in the 2019 volume of the Journal of Applied Behavior Analysis. It should be available to access, but if you can't access it, please feel free to shoot me an email to request access to it, to request access to these slides, or to ask any questions if you have them. Thank you so much for your interest and engagement in this study. Please, if you're interested, give us a follow, the Behavior Analysis Research Lab on Facebook and Twitter. Thank you so much.